Hello and welcome to this exclusive interview. Today we're talking to Dr. Julitta Onabanjo. She is the UNFPA Regional Director for South and Eastern Africa. Welcome.
Thank you, John.
And let me welcome you to Malawi if it's not too late.
The warm heart of Africa.
The warm heart of Africa.
Really welcomed me.
Your first time to Malawi?
It is, indeed it is.
I hope you're enjoying it.
Oh, I've totally enjoyed it.
You're coming at the time when it's actually the hot heart of Africa, because it's very hot now. It's so no longer warm.
Indeed. And it's a tough time for Africa.
It is.
With COVID.
Exactly.
So this is good to be able to get to countries and to see the effect and the impact of COVID.
Exactly, and we'll get to talk about COVID later, but let's get started by looking at where we wanted to be as Africa and where we are. 2020 actually marks the close of FP20, Family Planning 2020, where countries, governments, civil society agreed that they were going to put 120 million additional women and girls onto contraceptives by December. And my goodness, time is running out. The question is, how have we fared in this race?
Indeed, in 2012, when countries, partners came together at the Global FP 2020 Summit in London,
yes,
they were bold, and they made bold commitments to really ensure that rights and choices were there for women of the world, and it was a global meeting. And Africa, of course, committed also very boldly, so they are part of a global movement. We have fared, I think, as a continent quite well. However, we do say that there's still much more to go, because if a woman really doesn't have the ability to choose and to make those decisions around her family size, when she wants to start having children, does she have the means to have those children? Does she have the means to space her pregnancies? Then we really haven't done yet what we need to do. And last year, when we were in Nairobi to mark the 25th anniversary of the International Conference on Population and Development, we then recommitted, indeed quite boldly, that we will shift the goalpost a little bit to 2030, and that we will take those bold commitments not only made in Cairo 25 years ago that are unfinished for women, but also we will commit even more and reaffirm our commitments to 2030. And so with that, I do feel that we have a little bit more time, but time is not on our side, and that's for sure. And what we find, particularly having been in Malawi, is that while we've seen progress, and indeed the FP 2020 commitments gave impetus for us to move quite quickly in terms of ensuring women can get access to contraceptive methods to plan their families, the reality is that we now have reset those agendas, and we really are going to move forward in the same urgency and boldness to be able to meet the 2030 commitments. Malawi committed very strongly last year in Nairobi to reduce what we call unmet need for family planning. So that's a woman who wants to make that decision and has made that decision to plan her family, that she has access to contraceptive methods to do that.
Doc, I hope we don't fall into the trap of just committing to doing things and not doing much about it. I mean, 2012 up to 2020, that's quite a long period. And obviously we haven't met some of our targets, and now we're shifting the goalpost to 2030. But the big question is, are there any lessons that we have learned, especially maybe for Malawi, on what we can do better to make sure that maybe 2030 we are singing a different song?
Yes. Indeed, we've learned lessons, and I think one of the inspiring things for me, and I know that we want commitments to turn into action, and we're all very urgently calling for that. But sometimes the most important thing is that leadership commitment to the issue. And I think one thing that Malawi has done is, irrespective of which government, they have made these bold commitments to women's ability to have rights and choices. So that's, I think, the leadership, and I saw that in the new leadership that we have in Malawi, that the commitment and the understanding, because sometimes at the macro level, it is that understanding as to why should a woman have choices. What does it do in terms of translating that into not only their own rights and their ability to engage, but the whole community and the society? And we know that where a pregnancy is unplanned and unwanted, and where a woman is having many children, that is driving a population that is big. So that's one thing, the leadership. I think the second thing that's very clear is that commitment has changed into action. And in Malawi, we do see that the budget that has been allocated for family planning has been actually ring-fenced. And continuously it has grown. It is not enough, but definitely the government is putting its money where its commitments have been. And we see that in a budget line of about 280 million kwacha, Malawian kwacha every year, that Parliament has allocated, and that's kept to ensure that there's a ready supply of contraceptives. So that's a good example. And the third one is actually from Mangochi,
yes.
Where I was yesterday.
Where you went.
Yes. And indeed, what we found was, because of COVID, there was a disruption in service delivery.
Yes.
And so a woman's ability to get access to her contraceptives usually takes her into a static health facility. Mm-hmm. And in the restrictions that COVID provided, what happened was then she wasn't able to go and get her pills or her injectables. And there is a program here that builds community-based distribution agents, also health surveillance assistants and volunteers in the community. And they've been trained to be able to go door to door to ensure that a woman has a continuous effort and supply of her contraceptives. So that's a good program. It's a program in the region that we've known has worked very well. And Malawi has taken that program. And what's important in Malawi is that where we see the unmet need the most is amongst young people. So young people are not able to get their contraceptives. Young people are not even empowered. And so these community-based distribution agents are quite young. And so they've been, so that there is a little bit more of a age relationship in talking about contraceptives and some of the other sexual and reproductive health issues. So those are three good examples from Malawi that I think begin to show that we can really make it.
And it's interesting that you talked about COVID, which I think some people would say has been a necessary evil, because it has jotted us back to reality about some things that we were possibly beginning to forget about. One thing that Malawians woke up and realized, oh my goodness, are we doing enough about this, is when COVID struck and schools were closed, there was a surge in teenage pregnancies, which is interesting considering that Malawi had just come from making a commitment at the Nairobi Summit on ICPD to make SRH services accessible to these communities and making sure that they're youth-friendly. So clearly something didn't work there. And I think going forward, we must be asking ourselves, what does the surge in teenage pregnancies say about the importance of implementing these commitments and making sure that they're really turning into action? Because clearly something somewhere didn't work.
Indeed, COVID has exposed a number of things that were kind of under the carpet swept. And I feel that while I must commend Malawi for its response to COVID, I think what it did expose was a number of other crises, and particularly for adolescent girls and young women. And definitely the pandemic of teenage pregnancy and child marriage, but also of violence, was very openly exposed to us.
Yes.
And I think what that really shows is not only the importance of these commitments that were made, but the urgency with which they must be implemented. COVID, indeed, I think is beyond the response to COVID in terms of the restrictions that we saw and the school closures that young girls were left. But what it was is that they were being locked down with abusers for the most.
Yes.
And in a way, the impunity with which that happened also hasn't helped the situation. But what I think has been the opportunity is that it has put a real spotlight on the issue. And the national discourse, I must say, since in the days that I've been here, has been really all about teenage pregnancies.
Yes.
And what needs to be done, and what action can be taken, and at what levels can it be taken, from the highest levels down into the household and the communities. And it was inspiring to go to Mangochi and to actually work and hear not only from community elders, from mothers, but also from the school system, from the health sector, and from all society, including young people themselves, as to why we are seeing this, but what can we do? And that was very powerful.
If you're just joining us, this is an exclusive interview that we're having with Dr. Julitta Onabanjo. She is the UNFPA Regional Director for South and Eastern Africa. Stay right there. Welcome back. This is an exclusive interview which we're having with Dr. Julitta Onabanjo. She is the UNFPA Regional Director for UNFPA East and Southern Africa, and she's coming to Malawi when there is a heated debate about the pregnancy bill, the termination of pregnancy bill. My God, have we been having a rough time having a debate about this. People weighing in and making sure that their voice is heard. As we are saying, the matter remains unresolved because it's yet to be tabled in Parliament and debated upon. But we still want to know what you think about this, because the chairperson of the Parliamentary Committee on Health took this bill to Parliament, but as I said, it has not yet been debated upon. But what is UNFPA's stance on the movement to relax laws so that women can access what activists call safe abortion?
Interestingly, for first, I must say that I was so glad to meet actually the parliamentarian on the Health Committee.
Fantastic.
And so he gave me an opportunity, or he briefed me
Yes.
on the process that is going forward. And I think you hit a very important note where you said there's a lot of public discussion and debate.
A lot about it.
Because for any bill, for any legal instrument, it is important that we have the public and those who the bill is there to protect, and those who the bill is there or the law is there to ensure be part of the conversation and discussion. And I think that's what we are wanting to see as we move forward to really expand what already is a termination of pregnancy law that exists, that is very much just centered on the saving the life of the woman in terms of... I think the big issue for us, not only in Malawi, but in the region, is that a number of pregnancies, especially amongst young girls, are unplanned and unwanted. And what that means is that they're in a situation where they have to make a decision as to what do I do with this pregnancy. Many of it has also been out of violence, whether they've been raped
Yes.
or defiled. And therefore it really is a hard choice for an individual to make in terms of which way to go. I think for Malawi, what is very clear is that the number of those unplanned and unwanted pregnancies is very high. And particularly amongst adolescent girls, where teenage pregnancy in Malawi is the highest in the region. And so there is a resort to an unsafe abortion. And this then has its complications. And in Malawi particularly, what the data is saying is that at least 17% of maternal deaths that we see are because of an unsafe abortion or a complication of an unsafe abortion. And that's not acceptable. And so really what the law is trying to do is to expand the options for access to a termination of pregnancy so that at least for those who are abused, whether it's sexually or defiled in any form, they also have an ability to get a safe termination of that pregnancy. And that's the understanding of all that, and where Malawi is at becomes really important, and based on that is the need for evidence. The United Nations does not, and UNFPA does not in any way get call jury on some of these issues.
Okay.
What we do is ensure that the picture is understood very well, and what are the possible options in the law or in other ways to ensure and guarantee the choice to decide about a pregnancy that is unplanned and unwanted. Our emphasis is also very much on prevention or averting the recourse for abortion. And that's why the conversation around the unmet need for family planning for adolescents becomes really key. Because if a girl understands that she can plan her family, or she can delay her first pregnancy, for example, with a contraceptive,
yes,
then she's not going to have an unplanned pregnancy that then leads into an unsafe one, and then into abortion. So it is important to have the conversation.
Yes.
It is important to have the discussion. It is important that governments take the decision, but they must take it based on what they see is happening in terms of the lives of women and girls.
If you ask the average Malawian, they will often complain about laws which are just gathering dust. We have made many beautiful laws and policies and strategies, but most people complain that we don't implement them. I think one of them is when they outlawed marriages of girls below the age of 18. Everybody celebrated that, but now a couple of years down the line, people wonder if we're doing enough to do that. I just want to pick your brain on what you think the future looks like for Malawi if we do not continue to implement the laws that we make with the urgency that they deserve.
Yeah, indeed we must. We really must implement laws. You can't have laws just gathering dust, because the reason why they're made is to ensure protection, to ensure that life changes for those who they are there to support and protect. And so I don't even begin to see a situation where we can't enforce the laws. What we're seeing, particularly for child marriage, is it is working from many directions. So there's the legal framework and the protection, which is really key and fundamental. But it also must come from the bottom, where the culture, because child marriage, by and large, is built in a society and a cultural practice. And those who are custodians of those practices need to also understand that there's a reason why a girl should not be married before the age of 18. She will have, again, a child pregnancy.
Yes.
She will have she will probably die in childbirth.
Yes.
She will be pulled out of school, and that's what we're seeing. So there are many reasons why child marriage is just not good. And the culture needs to understand that and change and adopt. And I think one thing that's really been fresh and exciting here is how the society, and particularly cultural leaders in this society, are taking the action. They're the ones that are seeing and understanding and actually removing girls from marriage. They're the ones that are developing bylaws that they enforce, that allows, again, the action that's needed on those who marry young girls early. There's also a whole other system around why are still girls getting married.
Indeed.
A lot of it is poverty related. A lot of it is, again, this notion of the worth of the girl child. And so unless you address all those issues, in addition, obviously, to the enforcement that needs to happen, which involves not only the legal sector, but also the police, you won't get what you're trying to get. And I think Malawi's on a good road. We were in Doha, where we have a really exciting program supported by the European Union called the Spotlight Initiative. And there we have a mentorship program working with the district to ensure that young girls also themselves understand, what the potentials and the hazards are of early child marriage, and just the need to be inspired to reach higher heights. And in that program, what was really exciting was how the women lawyers recognized again that it goes beyond the law. It has to be connected with the police force, and in a way they need to ensure that, you know, where laws are there to protect a young person, if they're not enforced and the perpetrator gets away with impunity, then you're not helping the situation. And so there's a lot of effort collectively to see that we can make forward and move forward on enforcement of laws. But for UNFPA, we really do believe that we can't think of a situation where, you know, laws don't translate into enforcement and indeed into a change that we want to see.
I'm glad that you touched on the DOA project, and I just want you to tell us a bit more about what UNFPA is doing in collaborating with government, the government of Malawi, to achieve the Sustainable Development Goals. The President, Dr. Lazarus Chakwera, did talk about that, about the Malawi government's commitment to achieving the Sustainable Development Goals, and I know that the UN is the one that leads in implementation and ensuring that governments achieve these goals. How are you working with the Malawi government?
Well, UNFPA, the United Nations Sexual and Reproductive Health Agency, is part of a family of the UN system that has been working with Malawi for many years. We go back almost 40 years, even though we are 75 years as a UN system. And in a way, we are here to accompany government in its development efforts, very much aligned to what is their vision and their priorities, and how we can bring not only the support, the technical expertise, the policy advice, to be able to ensure that those policies go forward. UNFPA particularly has been working with government around what population matters. So looking, and last year in 2018 actually, we were able to support this government in their population and housing census, which provided a wealth of demographic data right down to the village and the household level. And that allows, I think data becomes really fundamental and key in development efforts. It allows us not only to identify where populations are, what is happening to them, where the vulnerabilities are, and how we can ensure that programs really reach and leave nobody behind. And so that's one of the areas that we've been working very closely with the government to build the capacity around data collection, but more important, analysis and use and translation, so that even the individual understands that I've been counted, I matter, and these are what is available to me. On health is another area that we've been working very closely with, and of course, as I said, we are the Sexual and Reproductive Health Agency, so ensuring really for us that every pregnancy is wanted, and that's why the work on family planning, that every childbirth is safe, and that's the work on maternal health within the health system, ensuring that we can get an integrated package of services for women and that gets delivered. And then to be able to ensure that violence is protected. So violence, particularly gender-based violence, and that's why the work on child marriage and harmful practices we do. But I think fundamental to us is the fact that Malawi is such a youthful population.
Yes.
I mean, if 80%, just under 80% is below the age of 35, then that's the population that we're looking at and we're focused on. And so we've really worked as well to ensure with the Ministry of Youth, to ensure that young people also have a platform to express where they are at in development, to express what are some of their needs, but also to get the leadership qualities and skills to also engage. So it's a really comprehensive program. It's one that we've had, again, as I said, for quite a while. It's a cooperation within a broader corporation of the UN system called the United Nations Sustainable Development Cooperation Framework. And we continue to commit to that. And so that was why my mission was good, to see how we can even strengthen that cooperation across sectors, across systems, and most important, with the population.
Dr. Julitta Onabanjo, it's been a pleasure talking to you, and I wish you all the best.
Oh, thank you. It's really a pleasure.
And that's how we come to the end of this exclusive interview. I've been talking to Dr. Julitta Onabanjo. She is the UNFPA Regional Director for East and Southern Africa. My name is Joab Frank Chakaza. Until next time, it's goodbye.